Okay, this is Javier again. This is my video for OSCE number 5, internal medicine. Now I'm going to be doing case number 10 on internal medicine, page 120. And this case is about 25-year-old female. It's Julia Gordon, who comes to the office complaining of leg pain. And this is going to be my examination area again. This is going to be my patient again, Mr. Rosete, and this is my examination area here. Okay, and I'm going to start in the minute number 1. And let me see how we can make this. Okay, ready? Okay. Hello, Ms. Gordon. My name is Javier Fleites. I'm a PA student that's going to be helping you today. And what brings you into the office today?
I have pain in my right leg.
Okay, Ms. Gordon, when did the pain start?
Started 2 days ago.
Had you had any trauma to the leg?
No,
Had you run any fever?
no,
Had you experienced any shortness of breath?
no,
What about any chest pain?
no.
And is there any possibility that you could be pregnant?
Absolutely not.
Okay, is there any past medical history or medical condition you would like to tell me about?
I've never been ill before. I was feeling great until this happened.
Okay, what about any family history of clots?
No,
Okay, do you use any tobacco products?
I had smoked 2 packs per day for 5 years.
And what about any drug use?
No,
Okay, are you on any medication?
birth control for 7 years.
Okay, birth control. And what about being on immobilized for a long period of time, like for example, a long plane trip or a car trip?
Nope. In fact, I walk vigorously, 3 times a week. I sometimes walk 5 miles for exercise.
Okay, and what is your occupation, Mr. Gordon?
I'm a graduate student majoring in American history.
Okay, thank you for the information. You allow me, I'm going to be washing my hands and I'm going to return for the physical examination, okay? Okay, I wash my hands and I come back and we're going to start the physical exam by listening to the lungs, and we're going to make sure to we do this in a ladder-wise manner. We're going to start the apex. We're going to go down to the base. We're going to compare in left and right lung fields. Okay, when I touch you with the stethoscope, just take a deep breath and then exhale, okay? Okay, there is normal lung sounds, and now we're gonna inspect the now we're gonna do it in here so you can see this better. We're gonna be inspecting both extremities. We're gonna be comparing for any swelling or changing color, and this we can see that the right extremity is the right lower leg is erythematous, is red. It's warm to the touch, and does it cause any pain?
Yes, yes.
Okay, and it releases pains upon palpation. After that, we're going to be checking for the pulses on the foot. We're going to be checking arterial pulse here. We can do it in the tibial artery, or we can do it here in dorsalis pedis. And there is normal pulses in the foot. And after that, we're gonna check for Homan sign. Homan sign, positive Homan sign that releases pains is gonna be suspicious for the DVT of deep vein thrombosis. We're gonna try to reproduce it in here. We're gonna squeeze in here in gastrocnemius area. We're going to grab the calf, and we're gonna do a passive dorsiflexion on the foot while we press down here on the gastrocnemius. Does it cause any pain?
Yes.
Okay, and there is severe pain with the Homan sign, which is highly suspicious for the DVT. Okay, and thank you, Ms. Gordon. After all the information we have gathered today, that you have provided us, and the information obtained from the physical examination, we came to the conclusion that you could be having a DVT or deep vein thrombosis, where the deep vein thrombosis is a thrombus that is in your main veins in the lower extremities. In this case, could be in your right lower extremity. This is a very serious situation because this thrombus can travel to your blood system, through your inferior vena cava, can go to your heart, and from your heart can go to your lungs, and it could cause a pulmonary embolism, which is an emergency. Due to the serious condition, we also are thinking the differential diagnosis could be also cellulitis to the reddening and that we're noticing in the lower extremity. It could also be a popliteal cyst that could be causing this pain. It could be a muscle rupture, or it could be arterial insufficiency in the lower right extremity causing this pain. Due to the nature and seriousness of your condition, we're going to order some immediate exams. There's going to be emergent examinations. We're going to order duplex binaural ultrasound of the lower extremity. This is going to help us see the structure of your veins and if there's any thrombus in there. We're going to order some blood tests like a CBC and platelet counts. And we're going to do some coagulation studies like PTT, PT, and INR. It is important that we reinforce that this condition is really emergent, so we're going to recommend your admission to the institution today. And upon confirmation of the DVT, we're going to start anticoagulation therapy with heparin injection for at least 10 days. And after the confirmation that this clot has been dissolved, we can change you to oral therapy and discharge you on oral anticoagulants that like Pradaxa or Xarelto that are going to prevent these thrombus from reoccurring. Also, we wanted to tell you that there's two important risk factors that are affecting your life today. The first one is smoking, and the second one is the birth control containing estrogens that you're using. This can be a risk factor leading to these thrombus that are being that could be forming in your lower extremity. We would strongly recommend, upon confirmation of this today, that you stop smoking and that you change your birth control to, for example, an IUD or a different kind that our OBGYN doctor will recommend. And also, we wanted to tell you that we're sorry you're in pain today, but you came at the right time to us. I mean, this is something that we can prevent from getting worsening and causing a major emergency. And we're going to be working on this right away. Do you have any further questions for us?
No, thank you.
Okay, we're going to be running your test right away, and we're going to be working on it. Okay, we're going to be admitting you right away. Okay,
Thank you.
thank you.